Hi, welcome to City Vision's Introduction to Christian Addiction Counseling course. In this lesson, I'm going to talk about addiction counseling licensing and certification. I'm Andrew Sears, and this course is available for free. The non-credit version of the course is available for free at cityvisioninstitute.org. So, just to give you an overview of the addiction counseling organizations and certifications. So the way it works is in the US, most states will work with the standards that are established by one of two bodies. So NAADAC, which is National Association for Alcoholism and Drug Abuse Counselors, it's US focused. And typically you have these different levels. So the lowest level is, and this is fairly new, is the National Certified Peer Recovery Support Specialist, and often there's state licensing standards that kind of map to a lot of these things. National Certified Addiction Counselor level, one in NCAC, and level 2. Then you have some specialties: nicotine dependence, adolescent addiction counselor, and then the highest level within NAADAC right now is the Master Addiction Counselor. And then you also have another organization that's kind of the international counterpart, but it's also used fairly widely by a lot of states, International Certification Reciprocity Consortium. And so there you have the peer recovery, you have a prevention specialist, so that's different, not really offered by NAADAC. You have criminal justice addiction professional, alcohol and drug counselor. So this is often most closely related to this CAC. And then advanced alcohol drug counselor. So that's like the level 2. And then clinical supervision is probably closest to the MAC. Now, it's important to recognize the difference between certifications and licensing. So and certificates. So certificates are typically provided by a university for a collection of courses, less than a degree. If certificates are offered, if they're not offered by an accredited university, they're just a piece of paper. So any organization can say, I'm going to give you a certificate. But, and it's nice to have something you can put on your wall that shows you completed their training, but it's not going to be recognized in other places. Now, certification, on the other hand, is they're offered by an association, and be sure that they are industry recognized. So NAADAC is recognized. Now, what makes this even more confusing is some states use the word certification to be synonymous with licensing. Other states just call it licensing, but the most common, if you're going to be working with a state, it's called licensing. So that is where a state, or if you're in another country, the government authorizes an individual to be an addiction counselor. Some countries don't have the category of addiction counselor, they just have counselor. In the US, it's often tied to insurance and receiving Medicaid. So often you'll have to be a licensed center, and then to be a licensed center, that means that the people who are doing addiction counseling, usually the way it works is there's a hierarchy. You have the higher level counselors supervising the certified addiction counselors who might supervise the peer specialist. And that's kind of the different categories, and it's important to recognize these differences. So addiction counseling licensing really is the thing that most people are most interested in, because it's the one that carries the most weight in terms of jobs. The other things are less significant. It's probably worth just stating certification, like NAADAC certification, is good to put on your resume. And one other thing is that most states will align with NAADAC or IC&RC standards, but the certification from NAADAC's different. So most states will require some combination of education hours. So City Vision courses typically will count towards that. Some states also may have components that require local in-person training. They might have an ethics course that requires 4 hours of local training, and for whatever reason, they don't want anyone else other than the state to offer that. That's a common thing. Or sometimes for peer support, some states will require that be local. Then there's an exam. So City Vision courses are aligned to help you pass the exam. We have a certification exam. Then there's supervised practicum hours that you can receive through a practicum course. and then there's work experience hours. So that's usually supervised work experience hours, and you have to usually be under a licensed addiction counselor or some other licensed counselor. So let me just use an example. So City Vision is, as a university, we're headquartered in Missouri. So I'm going to use this as an example. So Missouri, you have something called the Certified Alcohol and Drug Counselor. That requires 180 hours, and City Vision can count towards that, and then 300 practicum hours. And then on top of that, they have experience hours. So if you only have a high school degree, you have to have 4,000 supervised experience hours, and associates 3,000, a bachelor's 2,000. Then you have to pass the IC&RC alcohol and drug counselor exam. Now, NAADAC has a certification that will help you in your finding jobs, but it's not as critical as licensing. And you have the National Certified Addiction Counselor 1, and you have the number of hours. Now, it's important to note the total number of experience hours is a lot higher, and this usually they require an active state license for that. Now, our program is focused on addiction counseling, but there's other levels of counseling licensure, and usually addiction counseling is at the bachelor's level, while most of the other ones are at the master's level. Not always, but so the gold standard in many cases is the licensed clinical social worker. There's a group called this CSWE accreditation. So the schools that are under that, the cost is the most. In many cases, might cost $60,000 to get this, and often it can take longer. For many people, the sweet spot is the licensed professional counselor. So that's called the LPC. The accreditor is called KCREP. It's a master's. I would say, it's considered the silver standard. It has significant cost, but if you're looking for what are you going to do after your bachelor's, for most people, I would say like 80 or 90% of our students, this is probably going to be your best option. If you want to go for the high end, you might go for the licensed clinical social worker. And if you're going to go for, say you want to do more marriage and family therapy, then there's a licensed marriage and family therapist. Then there's some others out there, clinical pastoral education, that many people associate that being more aligned with more liberal denominations. There's the board certified chaplain if you want to be a chaplain at a hospital. The main advantage of licensure is there's many more jobs and much higher pay. The disadvantage is that most require a master's degree that are often long, costly, and in most cases indoctrinate fairly strongly in a secular worldview and framework. Now, it's worth recognizing there are some non-licensed certifications. There's pastoral, there's American Association of Pastoral Counselors, National Board for Certified Pastoral Counselors, Biblical Counselors, ACBC, and CCEF are two of the big ones. You could become a certified life coach. It's worth recognizing that this will help your resume, and if you open up your own shop to do say coaching, then you can do that. In many states, it's worth noting that many states protect the term counselor, that you cannot call yourself a counselor in the state unless you are licensed, and you'll get sued. So there's been cases that show that you can call yourself a coach, or you can call yourself a pastor. And so, recognize that case. Now, let's talk about the different professional development paths in addiction counseling. So for many people, they're going to start at the peer support specialist. And that is really, people have said that what this is doing is it's professionalizing the job that used to be in 12-step for the sponsor. I think, and part of the reason why agencies do that is you can get a lot of people in that category that then become billable. Their hours become billable, and you're able to have this. One of the big challenges is the gap between someone finishing an addiction recovery program and then becoming a licensed addiction counselor is a big gap. So this gives a intermediate step. And some states, what's interesting about this certification, which I think is great, some states, a requirement to get this is that you have to have been a former addict. So there's very few jobs that where it's actually an advantage to have been a former addict, to get the job. Now, the biggest category is the certified addiction counselor, or the licensed addiction counselor. I'm using the term certified and licensed as synonymous in this case. And usually in most states, you're going to have multiple years for the CAC 1 or the alcohol and drug counselor, and then there's going to be more for CAC 2. And there you're going to have certification prep. You're going to take addiction counseling courses like you do. So we're trying to prepare people for these two levels. Some people can go directly. A lot of people, I would say most people, go directly. But if you're a recent graduate from an addiction counseling program, sometimes it can be helpful to get this as an intermediate step. Now, after you become a certified addiction counselor, the question is, what are you going to do? For some, you become a master addiction counselor. And that takes a lot more training. It takes getting a master's degree. Others, you're going to get a master's in clinical social work, as I explained before. And then for others, you're going to get a master's in clinical counseling. So City Vision covers these top two categories. We don't yet do this bottom category, partly just because we need to be larger for that. So within addiction counseling, to get certified/licensed, you need to gain mastery over these 8 practice domains. And that's what we're covering in the Introduction to Addiction Counseling book that we're using in this. And what's important to recognize is what we're trying to do here is we're trying to do at City Vision. You have all these domains. Each of these have some component of secular worldview in those, and we're trying to provide Christian worldview, Christian integration, and we have a lot of summary courses that's going to inform this. So as we talked before, what you're trying to do with Christian worldview is you're trying to have a lens that you're interpreting everything with. So essentially what we're going to do is prepare people so that we prepare our students to pass the licensing certification, but also to do so with a Christian worldview and not to have a secularized worldview. So within addiction counseling, there are the 8 practice domains, and then often they'll talk about the 12 core functions. And it's worth trying to translate between those two. So the 8 practice domains, and there's a map between these. So clinical evaluation, within the 12 core functions, there's actually 4 parts. So that's screening, intake, orientation, and assessment. Treatment planning is the same between the two. Referrals are the same between the two. Service coordination maps to case management. Counseling includes counseling and crisis intervention for the 12 core functions. Client, family, and community education is client education. Documentation is reports and record keeping. And professional and ethical responsibilities is consulting with other professionals. So within City Vision's addiction counseling courses, part of what we're trying to do, so we have our core courses. This course, Introduction to Christian Addiction Counseling. Then we have certification prep, or you can take recovery coaching or peer support specialist, professional counseling practices, drugs of abuse, counseling foundation, spirituality and addiction, case management, counseling in urban and multicultural environments. Now, these core courses are going to cover 8 core functions in the 12 practices. But then we have a lot of courses where you'll go deeper. So we have technology, life balance, and behavioral addictions. A lot of addictions focus on chemical addictions, but one of the things I've noticed is a lot of recovery ministries, they transition people from being chemically addicted to becoming behaviorally addicted. And they'll join their staff and they'll be workaholics and they might be codependent, but they never really grow beyond that. So that's an important course. Family issues and recovery, sexual issues and addiction, group counseling practices, mental illness, addiction, dual diagnosis, counseling alcoholics, chaplaincy, vocation calling and purpose of work, nonprofit educational program design, and educational recovering programs. or managing residential recovery programs. So what we're trying to do is cover all those things. A lot of these have deep faith integration, and that's really important to us. We want to have all these things, include deep worldview, Christian worldview as a part of that. So hopefully all this is helpful in understanding how you can get certified and licensed. And if you have any questions, please ask your faculty member, and please share this course with others. It's available for free on the City Vision Institute website. Thanks a lot.